Good morning, everyone. My name is Rebecca Canaday, and today I'll be talking to you about forensic pathology and the autopsy process. So what is forensic pathology? Forensic pathology is a branch of medicine that applies the principles and knowledge of the medical sciences to problems in the field of law. The job of a forensic pathologist is to perform autopsies when necessary for sudden, suspicious, or unexplained deaths, determine the cause and manner of said deaths, and testify in court as an expert witness. Who do they interact with? Forensic pathologists typically engage with other professionals in the field of forensics, law enforcement, assistants, and also investigators. An overview of the autopsy process. An autopsy, or postmortem examination, is a surgical procedure in which a decedent is thoroughly examined externally and by dissection for the purpose of determining the cause and manner of death. Essential components of a forensic autopsy include a thorough examination that overlooks nothing of importance, the preservation of observations by written and photographic records, and finally, the completion of a professional report of observations that is void of any bias. This was actually discussed in my medical legal death investigation course. The overall steps in an autopsy include the external examination and preliminary procedures, the Y-incision and removal of the chest plate, the removal of the organs, the collection of samples and stomach contents, the head examination and removal of the brain, and lastly, the return of remaining organs to the abdominal cavity. Moving on to preliminary procedures. The body is observed in the condition it was received before clothing, jewelry, and preservative items, such as paper bags over the hands, are removed. These articles are to be preserved and stored appropriately. Photos are taken, and observations of the body in its unaltered condition is observed and made note of. At this point, if the pathologist is assisted by an autopsy technician, they would help shift the decedent from a supine position to a prone position so that the pathologist may make necessary observations of traits such as rigor and livor mortis, contusions, injuries, and so on. The vitreous humor, which is the transparent fluid in the eye, is removed from both eyes and preserved for potential toxicology tests. This is because the eye is isolated and well protected anatomically, meaning the vitreous humor is typically preserved despite any possible head trauma, and is substantially less subject to contamination or putrefactive change than blood or cerebrospinal fluid. It has also been observed that chemical changes occur much more slowly in vitreous humor than in the blood or cerebrospinal fluid. Then the age, height, weight, sex, ancestry, color of the hair and eyes, state of nutrition and muscular development, scars, tattoos, old and recent trauma or abnormalities, and the condition of the teeth should be noted. When opening the body, a Y-incision is made from the shoulders to the sternum, and then down the abdomen, ending about 15 centimeters above the symphysis. The skin flaps are reflected away from the chest plate and the abdominal cavity. The chest plate is then removed by cutting the ribs medial to the costochondral junction using an oscillating saw, bone shears, or pruning shears. For the thorax, the thymic fat pad is bluntly dissected from the pericardium, and the thymic vein is cut where it enters the innominate vein. The pericardium is carefully opened, and the pericardial surfaces and contents are inspected. The heart is then lifted, and blood samples may be drawn from the left atrium. The trachea and esophagus are transected, and the diaphragm attachments are cut, while the thoracic and abdominal organs are retracted. The lungs and organ block is retracted while the pleura is cut from beneath it. Next, the entire block is then detached from any remaining connections to the vertebral column and removed. Moving on to the abdomen. A slit is made through the mesentery, and the proximal jejunum is clamped before a cut is made across the bowel. The mesentery can then be detached, the colon removed, and the small bowel and colon opened and cleaned. The stomach is then removed and its contents are collected. For the neck organs, the carotid arteries are retracted and the neck organ block is freed with a blunt dissection. The neck organ block, which includes the larynx, trachea, esophagus, thyroid glands, and parathyroid glands, is then detached by cutting anteriorly and medially on the inner aspect of the mandible. The skull and the brain. The scalp is incised from behind the right ear to behind the left ear, and the scalp is reflected down toward the hairline. The calvarium is then cut with an oscillating saw, and the dura is detached from the skull cap. The dura is reflected toward the midline of the brain, and the brain may be observed before retracted, and the optic nerves and carotid arteries are cut. The cerebellum and brainstem are retracted, and the brain may be removed. In regards to special procedures, if the pathologist deems it necessary, an autopsy may also include X-rays and microscopic examination of tissues of the decedent. X-rays are frequently used to aid the pathologist in locating bullets or radiopaque objects in the decedent's body. For example, if a pathologist knows the decedent was shot from a particular direction from examining the entry wound, but there is no exit wound present, the use of an X-ray may be helpful in locating the bullet, which could be lodged in the decedent's back or abdominal cavity where it may be difficult for the naked eye to spot. Why is forensic pathology important? Forensic pathology is important because without it, the field of forensic sciences would be set back terribly. The application of medical sciences to postmortem examinations is critical for a comprehensive understanding of the way in which these deaths occur and how to apply the law to certain cases appropriately and justly. It is also noteworthy that through the outcomes of autopsies, pathologists have the opportunity to give the families of the deceased a relative sense of closure regarding the circumstances of their loved one's passing. What has pathology contributed to the sciences? Forensic pathology has contributed to the forensic sciences in countless ways, but perhaps it is most easily acknowledged in the way that it provides a route for positively identifying the cause and manner of an individual's death that is completely void of any bias. Strictly relying on the medical evidence present leaves little room for opinionated or unsubstantiated conclusions. A current example of this can be seen in Senator Richard Pan's Senate Bill 1303. In February of 2018, a California bill was introduced and backed by former chief forensic pathologist for San Joaquin County, Dr. Bennett Omalu, that would require state coroner and sheriff coroner's offices to be replaced with a medical examiner's office in counties that had a population of 500,000 or greater. This was after Dr. Omalu was presented with an attempt to, quote, control and influence autopsy conclusions by Sheriff Steve Moore, after Omalu's independent autopsy findings differed from the Sacramento County coroners of a man who had been shot and killed by Sacramento police officers. Overall, forensic pathology has helped the field of forensic science progress rapidly, and the autopsy procedure it applies today is critical in achieving conclusive postmortem analyses. These are my sources again, in case you missed any of the details. Thank you so much for your time, and if you have any questions, please don't hesitate to contact me. Thank you.